Hello, I am Dr Sanjay Banerjee, Gastroenterologist attached to ILS Hospital, Damdam. Fatty liver disease is becoming increasingly common in many parts of the world, affecting about 25% of people globally. It's linked to obesity, type 2 diabetes and other disorders characterized by insulin resistance. What's more, if fatty liver is not addressed, it may progress to more serious liver disease and other health problems. Fatty liver occurs when too much fat builds up in liver cells. Although it's normal to have a tiny amount of fat in normal liver, the liver is considered fatty if more than 5% of it is fat. While drinking too much alcohol can lead to fatty liver, in many cases it doesn't play a role. A number of fatty liver conditions fall under the broad category of non-alcoholic fatty liver disease, which is becoming the most common liver disease in adults. Unfortunately, fatty liver often goes undiagnosed and over time may lead to a more serious liver condition known as non-alcoholic steatohepatitis or Nash. This can lead to fibrosis, cirrhosis or even liver cancer. Fatty liver is also linked to an increased risk of other diseases like heart disease, diabetes and kidney disease. There are several factors that may cause or contribute to developing fatty liver. Obesity, and it's increasing in children. Excess belly fat, even in normal weight people. Type 2 diabetes mellitus, high intake of refined carbohydrates, consumption of sugary beverages like soda and energy drinks which are rich in fructose, and finally, an imbalance of bacteria in the intestine. In fact, a person may be apparently normal and may not even realize to have fatty liver. Some may have fatigue and weakness, slight pain or fullness in the right or center abdominal area, elevated levels of liver enzymes including AST and ALT, and an elevated triglyceride level. If your fatty liver progresses further, you may develop the following symptoms like loss of appetite, nausea and vomiting, moderate to severe abdominal pain, yellowing of eyes and skin. It's important to see your doctor regularly for standard exams and blood tests that can diagnose fatty liver at the early reversible stage. The condition is often spotted during an ultrasound scan of your tummy. In some cases, a simple blood test called a liver function test may produce an abnormal result and other liver conditions such as hepatitis are ruled out. But blood tests do not always pick up fatty liver. If you are diagnosed with fatty liver, further tests may be needed to determine how far the disease has advanced by a special type of ultrasound scan called fibroscan. Some people may also need a biopsy that can be analyzed in a laboratory. So children and young people who are obese with excess of belly fat or type 2 diabetes should have an ultrasound scan of their liver every 3 years. If you are diagnosed with fatty liver, it's a good idea to take steps to stop it getting worse. Unfortunately, there is currently no specific medicine for fatty liver. Treatment is recommended for associated conditions like blood pressure, diabetes, cholesterol or complications. You may be advised to have regular appointment with your doctor to know the status of your liver and to know whether the condition is getting any worse or not. Lose weight and avoid overeating if overweight or obese. Cut back on carbohydrates, especially refined carbohydrates, like high intake of fructose-rich foods and beverages. Include foods that promote loss of liver fat, like monounsaturated fats, present in olive oil, avocados and nuts, whey proteins, green tea and soluble fibers. Physical activity can be an effective way to decrease liver fat. Engaging in endurance exercise or resistance training several times a week or even high intensity interval training. However, even lower intensity exercise can also be effective. Choose something you like doing and can stick with it is your best strategy. International Nash Day, held on 12th June annually, is dedicated to increase awareness about non-alcoholic steatohepatitis or Nash amongst the general public, at-risk patients, medical community, public health authorities and the media.